So CBT is a type of talking therapy that focuses on the interactions between our thoughts, our emotions, our physical sensations and our behaviour. And it thinks about the interrelationships between all of those areas and works by thinking about how you can make changes in any of those areas to bring about whatever outcome it is that you're looking for. So CBT can be used in lots of different presentations, so people with anxiety, depression, low mood and psychosis.
So is that the CBTp bit?
Yeah, so CBTp is sort of the special, they've just added a P on the end, but it's used to describe when you use CBT for people who may hear voices or have some strongly held beliefs that are quite distressing for them. So it's just an adaptation of more traditional CBT. So usually you come along and meet with a therapist that may be a clinical psychologist or a CBT therapist, and there's somebody who's sort of specially trained in CBT, and you would meet together and decide on particular goals that you have, so what area you're wanting to work on, and then you would kind of focus in on the best way of treating whatever it is that you're struggling with. And you may start to make some changes with your thinking or what you're doing or not doing or the physical sensations in your body. And by working on any of those areas, hopefully it brings about change in all of the other areas too. So normally your care coordinator might accompany you to some of the sessions, but they wouldn't be the person delivering the treatment unless they are a psychologist or a CBT therapist. So you would meet a different member of the team. But we do this really, really flexibly, really. So if you would like your care coordinator to sit in on your sessions, that's really possible. So I guess it's part of a package of different interventions that we offer within EI, and there's quite a lot of research to show that CBT in particular can be really effective for helping people recover from psychosis and stay well. So it's not that you can only have one part and not do something else, so we're really happy for you to do CBT and attend the groups, and also it's possible to be having family intervention as well as having CBT. Yeah, theoretically, yeah, but we kind of think with your care coordinator about what the best fit is right now, and sometimes it could be a little bit too much having everything at once, so that we'd do some thinking with you about what is the thing that you need the most at that time, or the thing that's going to bring about the best change at that time for you. No, it can really vary, and we kind of try and do it very from an individual perspective. So it's about what your greatest need is at the moment. You know, finding housing and things like that is the thing that you're needing to work on first. You do that, and then come along for the psychological therapy, the CBT, when the time is right. So that could be at any point in your 3 years, really. Some people have it much nearer the start. Other people, it fits much better for them nearer the end. So can you have CBT if you're on medication? Yeah, we often work with people who are on a variety of different medication. The only thing we would say is it's about whether that medication impacts on your ability to take part in the psychological work. So sometimes in terms of if you're coming to sessions and you're feeling overly sedated or you're not able to take on board the information, then we would work with your other part of the care team to think about any adjustments. But yeah, you can definitely have CBT while being on medication, but also you don't have to be on medication to have CBT. So CBT is a time-limited intervention, and what we mean by that is that you have a specific number of sessions which would be negotiated with your therapist. We're quite fortunate that the NICE guidelines give us 16 sessions of work with people, but we do have some flexibility in that depending on what you're working on. But it would always be time-limited, and it wouldn't go on, for example, for your 3 years of time with EI. So some people we do see for a second sort of phase of treatment. if a different issue arises, or sometimes that happens if people have struggled to kind of take part in it in the first place for whatever reason. Perhaps it wasn't just the right time, that they might come back for a second kind of phase of treatment further down the line. So in terms of how you access CBT, that would be initially through a conversation with your care coordinator. They would have, they'd probably fill in a referral form to the team, but it would just start with a conversation really about if this is something that you're interested in. Your care coordinator would talk with you a little bit about what you were hoping to get from the intervention. Maybe you might think about goals and things like that, or what you wanted to work on. And from there, that would start the process of a referral into the specialist psychologist or therapist.